So good afternoon, everyone. I'm Rana Jawad, convener of the MENA Social Policy Network. Thank you so much for joining us. And thank you for, first and foremost, for our speakers, Nicola and Bassam, for rejoining us. And I'm so sorry about the technical difficulties we had last time. And I know everyone's been really excited and waiting to hear you speak. So thanks to everybody for coming again today. Just to let everyone know that we are recording today's session, yes? So I hope you're fine with this, and presumably you will have accepted this, but just to make you aware that we are recording these webinars. So there's a message in the chat, yes, welcoming you all. Brilliant. Colleagues, I just want to introduce our speakers and we will get going. So our speakers will have around half an hour to present, and then of course what we want to encourage is a Q&A, whether it's through the chat or in person. You are more than welcome to intervene and comment, and hopefully we'll all have very good discussions. So our speakers are very well seasoned on issues of social and refugees amongst groups that are perhaps even more affected in the Middle East and North Africa region from conflict or from gaps in social protection, these being children, adolescents, and women. I shall introduce them now. So very pleased to welcome Dr. Nicola Jones, who is based at the ODI in London, where she is Principal Research Fellow and oversees the Gender and Equality and Social Inclusion Group. I hope I've said that well. So Nicola is the director of the DFID-funded Global Mixed Methods Gender and Adolescence program called the Global Evidence Research Program, and her expertise lies in the intersection of gender, age, and social inclusion and social protection. And she's worked extensively in the MENA region, and it's a pleasure to have her as a supporter of the MENA network as well from its very early days. So welcome, Nicola. Also a massive pleasure to welcome Dr. Bassam Abu Hamad, who is based at the Al-Quds University, particularly in the School of Public Health, where he is Associate Professor in Jerusalem, and he is also currently Associate Regional Director for MENA for the GAGE research program, and a collaborator of Nicola. And I shall now cede the floor to both of them, and thank you both. Over to you.
Thank you very much, Rana. It's a pleasure to be here. Good afternoon, everyone. So today we're going to be presenting on the extent to which social protection programs make a difference in supporting adolescent well-being in Jordan and Palestine, so two countries in the MENA region that have been very affected by forced displacement. So next slide, please. So next slide. So just to set the context, can you move the slide? Thank you. Just wanted to highlight that within the social development agenda, social protection is embedded across a number of goals, so including SDG 1 on eradicating poverty and SDG 10 on reducing inequalities. And I think what's really important to think through is that 149 of the world's developing countries have a social transfer scheme. So there's already a platform which can be leveraged to better support young people's well-being and transitions out of poverty. However, what the evidence base underscores is that most programs are not gender responsive. They often focus on women as a way to invest in children, but take too little account of the specific gender needs of women themselves. And they only really, in the design, think through men's gender specific needs and vulnerabilities. When we then turn to young people, then few programs outside of pilots consider adolescents' age-related needs. So while cash transfers have a strong focus on children, the focus tends to be on support to the household to support younger children, especially those under 5s. and where adolescents are visible in current programming, again, it tends to be limited to additional cash to support secondary school education. Next slide, please. So why is it important to have a specific focus on the second decade of life? So adolescents aged 10 to 19 years. I think in a nutshell, experts increasingly concur that this is a really critical juncture in the life course due to the very rapid physical, cognitive, and social maturation that occurs during this stage. Next slide. And what's also critical is that while it's an age of opportunity, there are also considerable risks. And so increasingly, experts and program implementers are trying to think through ways in which social protection programs can be leveraged to enhance safe transitions from adolescence into early adulthood. And the rationale is that by focusing on adolescence, it's possible to bring about a triple dividend for social protection investments. So supporting the well-being and development of adolescents themselves now, but also thinking about their potential as future adults and for their future children. What's key, however, to think through and what we want to focus on in this presentation is to attend to the nexus of age and gender so that programming takes into account the specific risks and opportunities that emerge for boys and girls due to powerful social norms that usually become more entrenched in the second decade of life. So for girls, this is particularly paying attention to heightened risks of sexual and gender-based violence, child marriage, and adolescent pregnancy. Whereas for boys, risks often include child labor, substance use, and interpersonal violence. And for both girls and boys, the risks of school dropout and risky sexual behaviors, depending on the context, may also be key vulnerabilities. Next slide, please. So the research that we're going to present today is from the Gender and Adolescence Global Evidence GAGE research program. This is an FCDO, UK government funded 9-year longitudinal study following 20,000 young people in the Middle East, South Asia, and East Africa. And there's a strong focus on finding out what sorts of interventions and social policies can best support young people to exit from poverty and promote their full capabilities in adolescence and then over the life course. So I'm going to hand over now to Bassam, who will present, first of all, our findings from Palestine. Thank you.
Yeah, good afternoon for all. So about Palestine and Jordan, we are going to start by giving an overview about the context. Then we'll move to social protections program. Then we'll be focusing in 4 domains: education, health, psychosocial, and violence. And then we end up with some policy recommendations about what worked and what could be done. Yeah, start by giving some background information about the context. So demographically, so there are around 5 million people living in West Bank and Gaza. In Gaza, the majority are refugees, representing around 66% of the population. Among them, 22% are adolescents, and people living in West Bank and Gaza have been subjected to protracted, prolonged, ongoing occupation and conflict and Israeli development policies, which really constrains the economy. Yeah, and this has been further deteriorated in the context of COVID-19. Yeah, in many ways, including a reduction in income. Particularly in Gaza, the unemployment rate and the poverty rate are extremely high. Maybe it's the highest all over the world, and it could reach up to 70% among young people. Food insecurity in Gaza reach up to around 60%, and there is too much reliance on externally donated funds. Yeah, 80% of people in Gaza rely on some kind of aid assistance, and during the COVID-19, around 34% of Gazans receive some kind of food aid. Regarding the social protection programs or assistance, we can call them, there are many actors, including governmental actors, mainly through the Palestinian National Cash Transfer Program, the largest one. We will talk in detail about that in the next slide. And also there are other governmental social protection programs implemented by, for example, Ministry of Social Affairs, Ministry of Religious Affairs, Ministry of Detainee, and other governmental bodies, in addition to UNRWA, which is also a major source for providing social support to people, in addition to the large network of international and local NGOs, in addition to family support, which is now decreasing due to financial constraints facing people. Regarding the cash transfer, which is the largest in terms of both the coverage, as it reaches around 120,000 families, around 60% of them in Gaza and the rest in the West Bank, and also in terms of finance, as it costs around $110 million a year, representing around 1% of the national domestic product. The program is based on the consumption proximity test formula, which contains around 35 indicators. The majority of them are poverty related. However, there are other indicators, including about disability and the chronic illnesses. In addition to the cash provided, there are also some kind of complementary assistance, including health insurance, access to emergency fund, also waiver for education. The amount that is being given to people generally is limited and ranges between $214 to $514 every quarter. So it's being paid 4 times a year, and it has been designed to bridge around 50% of the gap. However, the average consumption of the household is around $1,000, so the amount that is being given is not adequate. Regarding the vulnerability in education pre-COVID and then during COVID, and how the program, social protection program, address that, access to education is universal in Palestine. Maybe it's maybe the highest among the Arab countries. It's including also for females, and females really their enrollment rate and their completion of the schools at different levels are higher than male. Also, the same applies also to gender parity index. However, this come up with some gaps like economic challenges, strict access to school, and many families force their children to leave school, either to work in case of boys, or to help in domestic activities, or to marry in case of girls. School is very central in the life of Palestinian children. It's the place where they can go and interact with others. However, due to issues inequality, sometimes it turned to be unfriendly place due to the violence practiced by teachers and peers. During COVID, education continued, for the majority of people who were enrolled in education. So 90% of them continued somewhat access to distance learning. After the end of the lockdown, so they rejoined the school. However, there was too much pressure, especially in girls, to participate in the household responsibilities. Devices availability and the electricity connectivity also were very limited for children. And the contact with teacher was problematic somewhat. Mainly girls from UNRWA schools contacted their teachers. However, many of them did not receive feedback when they contacted the teacher. How the social protection program affect education? So the program designed more to address economic conditions. However, by doing that, they help somewhat in improving access to education. Also, some of the education costs were covered by the program. However, the impact was limited because the program wasn't designed to be child sensitive enough. It may affect more the continuity in school, or reduce the missing days due to lack of resources and the school expenses, as in the last point in the slide. However, it did not help really in enrollment or bringing back those who left the school. So the enrollment rate among the beneficiaries who receive and those who did not receive, when we compare poor people who are receiving the cash with the ones who are on the waiting list and did not receive the cash, we did not notice big difference or significant difference among the two groups, simply because families use the money more for buying food or paying health costs more than investing in education. In terms of health, the majority of adolescents think that their health status is good or perceive their status as good or very good. However, the key issues they think they are facing was smoking and substance abuse, psychosocial problem, chronic diseases, and nutrition. Also, we noticed that the knowledge about sexual and reproductive health, about puberty, is very limited, and the access to services is very limited, simply because services are not adolescence friendly, and also because the health insurance that is available is not adequate enough to enable people really to receive the services. Therefore, they rely more on out-of-pocket spending. During COVID, many adolescents reported that their health status worsened. Those who are sick were unable to access health services. The ability of household to secure food also decreased. 40%, especially in Gaza, reported experiencing hunger, especially married girls and girls with disability. Therefore, they are consuming less nutritious diet, and also many girls reported having difficulty in securing menstrual commodities. And among the married girls, also they face, pregnant married girls, they face difficulties in accessing maternity care. How the social protection programs contributed? Yes, it contributed. So it's used more as a survival policy. It contributed to the survival of children and enable families to buy more nutritious food, and to consume protein, for example, and to increase expenditure on food. And we found statistical significant differences between vulnerable people who are receiving the cash and those who are not receiving the cash. However, people with disability and the children, really the services and the package of services available is not really tailored to meet their needs. Therefore, families with children with disability have to cover the expensive cost of disability and to pay, for example, for assistive devices or for specialized care. So the health insurance was really of great value. However, the availability of services for adolescents was the main issue. In terms of psychosocial, adolescents in Palestine really face problems originating mainly from political turbulence, ongoing occupation, chronic hardship conditions, especially in Gaza, and the growing conservative norms. And these factors intersect together. As a result of that, adolescents believe that psychosocial is one of their most important problems, and 1/3 of them, they need psychosocial support. Half of them, especially in Gaza, show some signs of PTSD, and 20% scored abnormal in the strength and difficulty questionnaire. During COVID, so the already available stressors remain. Indeed, COVID was another additional stress for them. Therefore, many adolescents reported, despite being young in age, like 9% reported signs or suggesting moderate to severe depression using the general health questionnaire. In terms of severe and moderate anxiety using the GAGE scale, 19% in Gaza reported moderate to severe, severe anxiety. And the adolescents tend to internalize their problems, so and keep it inside them. They don't have others to communicate with them. They don't have trusted friends, for example. Yeah, half of them in Gaza, yeah, don't have, and only 27% in the West Bank they have. How social protection program contributing to a psychosocial well-being? It contributed indirectly through addressing some of the determinants of mental health. However, the program hasn't been designed really to address psychosocial vulnerability. Yeah, especially for children, and the social worker rarely pay attention to people's psychosocial needs, even when they visit the cache. However, we notice some differences, favoring people who are receiving the cache in the scores related to strength and difficulty questionnaire, hope scale, self-esteem index, and self-efficacy scales. So these were more higher positive, among people receiving the cash than those who are vulnerable and don't receive the cash. However, 80% of caregivers reported that the cash improved the chances of their children in the future, either slightly or largely combined. So they have positive perceptions about the program. Regarding violence, so violence is common, especially in Gaza, everywhere, at school, on streets, many children report being exposed to violence everywhere, even inside the household. Like, for example,
10 minutes
at the
left.
house.
Sorry, Bassam. 10 minutes left. Thanks.
Okay, so inside the house, the violence is used by parents to discipline the children, either physical or psychological, and sexual harassment is common and practiced, especially in Gaza. And also many adolescents reported quarreling with others. During COVID, so these stressors remain. In fact, these have been aggravated more, and there more tension at the household level, more at physical and also at emotional. Also, adolescents and children seeing more violence from fathers to mother, and also there's more pressure on adolescents to participate more against their desire in domestic responsibilities. How the program contribute to reducing the violence? Social protection programs. So violence is practiced regardless receiving the violence or not receiving the violence. No significant differences were noticed in this regard. However, it addressed some of the root causes of violence, like, for example, having resources in the household, reducing stress of the parents. These have some positive effects on reducing the violence. And also we noticed that the social workers, they don't pay attention at all. Like, when example, they see a child with signs of abuse, so they don't really pay attention to that. And we notice also that there's poor links between social protection programs and other social protection services and network that really provide comprehensive services for people who are exposed to violence, like Aisha, for example, Aisha Association. We not really found clear evidence about the effect of the cash on child labor. Also, many factors also are confounder and affecting that, including the job availability. And now I will handle it to my colleague Nicola to talk about Jordan. Over to you, Nicola.
Thanks very much, Bassam. So given the time constraints, I'm going to skip a number of slides, but happy to address any comments that you might have. I think overall, it's important to highlight that generally our findings tell a somewhat more positive picture about the effects of the cash transfer support for Syrian and Palestinian refugees in Jordan. And so we can discuss, why that is part of it, at least, is because of the higher overall monetary value, suggesting that there are some important threshold levels for really trying to address multidimensional poverty. So just very briefly, there are 3 at-scale cash transfer programs in Jordan. There's the National Aid Fund, which is targeting very poor Jordanians. So approximately 92,000 households are beneficiaries of that program. UNHCR has a cash transfer for the most vulnerable Syrian refugees in host communities, reaching around 32,000 households. And then UNICEF Jordan runs the Hajati Cash for Education program, which during COVID was reaching 18,000 children. And there's also food coupons from the World Food Program, reaching about 500,000 Syrians. Next slide, please. So just as in Palestine, the COVID closures had a very disruptive effect on adolescents' access to education, and the same kinds of concerns with the poorest and the most vulnerable having many more difficulties in accessing online education. Next slide, please. What we do find that for the beneficiaries, and especially those who are beneficiaries of the Cash for Education Hajati program, that it did have a positive effect during the COVID period. So enrollment and attendance were higher, and especially for those young people living in the informal tented settlements, who tend to be very isolated and generally have lower rates of school attendance. And also, very importantly, monthly expenditures on education were higher overall for cash beneficiaries. And our qualitative research underscored that cash became even more important to enable adolescents to continue their learning with the COVID school closures. Next slide, please. We'd also like to flag that there is linkages in Jordan between the Hajati Cash for Education programming and a plus component. So this is like a one-stop community center for young people to access. It's called the Makani Centers, and they are providing educational tutorial support, life skills support, and also outreach to the poorest households to re-enroll them in education. And they were able to continue this kind of support online during COVID, and had a large-scale tablet distribution program to support those young people. So the people who were benefiting not just from the cash, but the plus aspect, had the most positive outcomes. So that's something that I think is very important in thinking through recommendations for future proofing in such large-scale crises as the COVID pandemic. Next slide, please. So our findings again highlight that cash was critical in addressing the nutritional and health vulnerabilities of adolescents. If we can skip to the slide on the cash findings, Bassam. So what we found was that the World Food Program vouchers were critical in supporting household food security, but so were the cash for education transfers. So 88% of Hajati beneficiaries reported that cash had improved their children's nutrition, and this effect was sustained during the COVID period. In terms of violence, while we found less impact on the cash component itself, in terms of addressing the multiple types and levels of violence that adolescents are at risk of, the plus component, the one-stop centers that are part of the package of social support that refugees and very poor Jordanians have access to at Makani, as you'll see in the next slide, that this had a positive impact. Yes, so the key findings here were not only that cash and food vouchers reduce parental stress, but the programming curricula focuses on building adolescent awareness about their rights and where to report if they're survivors of violence at home or school, and that the Makani centers are able to make referrals to child protection experts and psychosocial workers. So I will stop here in the interest of time. On the Jordan case study, happy to discuss further in the Q&A, and I'll hand back to you. Thanks, Bassam, just to wrap up with the recommendations.
Yes, yeah, in terms of recommendation, yeah, in terms of education, so we found that the cash supported education, however, through the training on life skills and providing comprehensive interventions, it supported more access to learning, and it was very useful for children. So we suggest that the stipend should increase in order for to encourage boys enrollment in education, yeah, and the opportunity cost of going to work, and for girls also in order to overcome gender norms, which things that or which really regard investing in girls' education as not worth investment, and also to reduce child marriage. And we think that there should be more support for adolescents and children, through the distance learning, by providing them with the resources they need, including the airtime and the needed devices. In terms of health, we found that the assistance is critical to ensure food security for adolescents. However, services are not adequately tailored, and ignore the needs of the children. So services should be more age and gender specifics, and also there are many risky behaviors that should be addressed through prevention through health promotion and preventive activities, and also especially girls, they need more access to services, including access and free use of contraceptive methods. The COVID-related implications, we noticed that age-related risks have been aggravated, and also access to care has been limited. So it's really important to ensure access during crisis, in addition to regular times. Also, there should be more support for girls, including provision of dignity kits, especially in host communities and ITS, as children living there and adolescents are more vulnerable. Regarding violence, well, so when the program is implemented through a comprehensive package like Makani Plus, for example, we noticed that it contributed to reduction in violence rather than giving just cash. We also what is more is needed really. So there should be more investment in measures to control child marriage through further investment in secondary education, and also communication about child marriages and the consequences of that. So regarding COVID, so COVID had increased the violence level, and programs address the violence, including Makani Plus program should be scaled up. And lastly, in terms of the psychosocial, so cash contributed somewhat really to reducing household stress, and decreasing the issues, which really aggregate psychosocial problems. And some programs has increased children resilience, especially life skills and building self-confidence, and this contributed to improving their psychosocial well-being. There should be, I think, more programs to reach vulnerable children, including outreach program, and also to address social norms through parents' education, because sometimes so access to adolescents to these programs are not there. In the COVID context, because of the lockdown and the isolation and the distress, all these factors also do increase the psychosocial challenges facing adolescents. Therefore, there should be further investment and psychosocial interventions be part of any response program, and also the communities and families should be engaged in adolescence building, in adolescence resilience building skills. And for more resources, so we have a lot of publications that are available at the GAGE website, regarding the context in the two countries we discussed, and also other other areas in the region, including about Lebanon, also about African the work we do in Africa and South Asia. So you can have more detailed literature and resources at the GAGE website. And thank you very much.
Excellent. Thank you so much. Lots of food for thought there and really critical findings. Thank you so much, Bassam and Nicola. So we open the floor now to questions, comments for our speakers, please. You are welcome to put your hand up or post your question in the chat, and I shall try my best to chair. Okay, well, while colleagues are thinking and mulling over, can I volunteer with a couple of questions? So the first one is with cash transfers, you know, I think it's great to kind of get this critical insight on the impact of the programs that you've looked at. So the fact that the funding for these programs is often dependent, as you've also explained, on international donor funding. Kind of how well do you feel that this addresses the vulnerability of households that are dependent on these cash transfers? And I think this is probably a question that applies to other regions of the world, yeah, but it's that issue of funding them. So they have good outcomes, but the sustainability of them. And a kind of a sub-question, just to give people a bit more time, was how well do you feel the recommendations that you've provided are being listened to or potentially taken up by the funders of these programs? Thank you.
Great, thanks, Rana. Shall I start, Bassam, and then you complement?
So yes, please.
So I think it's a really good question. So in the Jordanian case, the National Aid Fund is funded by the Jordanian government. So that's the largest fund for vulnerable Jordanians. And I think what's been positive there is both UNHCR and UNICEF have sought to engage with the Ministry of Social Development to share lessons about appropriate targeting mechanisms amongst other kinds of capacity strengthening initiatives. So there's definitely been an exchange there. The funding for vulnerable refugees is very donor dependent. So for example, both the UNHCR and the UNICEF Cash for Education transfers initially had a much higher headcount, and that has been repeatedly reduced because of the volatility of donor funding. So I think that's a real risk. I mean, I think longer term, the goals of the UN agencies are to move towards a system whereby the National Aid Fund would reach both Jordanian citizens as well as refugees. And so there would be pooled funding to allow or to address that issue of sustainability. I think what's unusual, and there's some important lessons to draw from the Jordanian case, is that the twinning of the Cash for Education program for children and adolescents and youth with the plus component, the Makani initiative, has been very successful. So it's tackling some of those broader vulnerabilities that cash alone can't address. And that has been made sustainable. The program has now been in operation for about 6 years, and it is run through local CSOs and NGOs that have good community linkages. And I think that has really helped with sustainability. So initially there were a number of INGOs involved, but over time they've phased those out. They worked in order to hand over expertise and protocols and curricula, etc. But I think that's a very interesting and so far effective model that could be scaled up elsewhere, and really shows, I think, well, our findings highlight the value of not just cash alone, but cash plus a package of other complementary services. So Bassam, perhaps you could say something on Palestine?
Yes, so I think, yeah, so the last point, yeah, so the cash plus, I think it's a critical, but back to the question about sustainability. So in context like Palestine, so there were like different fragmented programs. So we have social hardship case, and we have the social safety network reform project, and these were like externally donated and separate programs. There was strategy by the Ministry of Social Development to unify all these programs and to establish a national, Palestinian national cash transfer program, in order really to support sustainability and to contribute more by the Palestinian Authority in funding that program. However, but honestly, so because the economic situation, in the context of occupation, and Israel controls the economy, they control everything, even so the resources that are available for the BA domestically from Palestine. So they control trade, they control exports, they control production, they control energy, and also they control the money that is being externally donated. And 40% of the people living in West Bank and Gaza are refugees. So UNRWA mandated to support them. But again, so the support being provided to UNRWA is also too much underpinned by the politics at the macro level. So so yes, in this context, it's very important to consider sustainability, but also there are contextual issues, and sustainability in context of occupation has a different meaning than in.
Of course, yes. And in fact, I mean, yes, and a lot of the research that has come out sometimes has shown that in spite of the conflict and the restrictions, I think the programs in Palestine have had good coverage and have done well in comparison to other countries. So yeah, absolutely. Thank you both. Great. So more questions now coming in the chat, and I'll just work my way through these. So from Mohammed Al-Ruzi, thank you so much, who's saying to you, great work. How was the impact of the cash program measured? Was it the subjective perception of the participants?
So good questions. So we undertook both survey research pre and post COVID. So the sample in Jordan is about 4,000. In Palestine, it's about 1,000. And so that was with both caregivers and adolescents. And then there are 6 thematic domains that we're looking at, and they were asked about their views on each of those. But we also used, as Bassam has highlighted, for the psychosocial measures, for example, internationally validated scales. And then we complemented the survey research with in-depth qualitative interviews with, again, adolescents and their parents, as well as the program implementers. So both of the cash programs and then the plus one-stop centers in the case of Jordan, and also a range of other service providers. So teachers, health professionals, social workers.
Okay,
anything
great.
else? No.
Do you want to add anything, Bassam?
So we are using mixed methods, as Nicola mentioned. So including also looking to the evidence, and these programs, especially it's funded by external donor, and they are keen. These are always under scrutiny and being investigating using different methods. So we listen to people, we talk to them, we use international tools. We talk also to the providers, to service providers, donors, and whenever possible, also we try to use any evidence that is being based on objective findings, even from the literature, because the approaches we use, it's mixed method approaches that combines the perspectives and the findings from the different sources.
Fantastic. Okay, next question from Karis Reed, who's moving to Palestine next month to work on social protection. So you may well meet her. Hi, Karis. So the question is, in terms of cash transfers in Palestine, how would you recommend to improve the results for adolescents? Is it to reform the existing program, for example, to add conditionalities or to extend wider government services in these areas? We've kind of touched upon that perhaps, but over to you.
So, do you want to start, Nicola?
I'll let you start since it's Palestine.
Yes, see, in Palestine, as I mentioned, the program is more economically oriented, and it's poverty based. And honestly, the aim of the program is to combat poverty. How much the program succeeded in that, I think too little. Yeah, but it prevented a further deterioration of people's economic status. Yeah, so when we did the work with them, we provided with them some models from other countries, including, for example, the model in Chile and in other places. So where they give a larger amount, for example, and with a clear exit strategy, and also trying, it's not just to give people amounts that is adequate for their survival, rather use the cash as part of a larger strategy that's really at the long run aims to by the end to enable people to get out of the poverty trap, including also using complementary services like vocational training, like employment opportunity. But by its current design, like for example, when someone works or join work and he or she receives the cash, then they cut the assistance, as if they tell people you have to stay. And we ask them a question: how many people came to you and returned back the cash transfer card and said, "Oh, thank you, I don't need your assistance"? And the answer really was almost none. Has done that. Regarding adolescents, through GAGE, we are really working in the MENA region, including also with the regional network like the Arab Coalition for Adolescents Health, to introduce adolescent-sensitive services, and using the social protection in its broader term. And last week, I presented and participated in a meeting, and people from Ministry of Social Affairs participated in that. So we liaise with the Social Protection Network at the Ministry, with Disability Department there, and we try to make the programs they provide adolescent sensitive, and to consider adolescents, to utilize better the social workers. We have large number of social workers who enter houses, and they can help us really to changing the norms of people, communicate the messages, and also to refer cases they notice. So when they notice oppression or violence or abuse for children and adolescents. So we are now at the process of really introducing the adolescents related services in the different component. And we started by using health as a good entry point because it's really related to other components. Do you want to add, Nicola?
Maybe just briefly to say in terms of what else could be done to improve the program, because it also addresses one of the later comments or questions I saw on intersectionality from Mohammed, is in terms of young people with disabilities, that families that are caring for children with disabilities tend to be have particularly stretched resources, and the allowance for caring for people with disabilities is very limited. It's not enough to cover the costs of purchasing assistive devices, maintaining them, getting the extra services that are needed. So I think that's really a critical area that could be improved for very, very vulnerable families, and particularly in some parts of the state of Palestine. You know, with cousin marriages, you have higher levels of some sorts of disability. So I think that's really an area that a huge difference could be made if there was more concentrated work. We did do an evaluation with UNICEF together with Bassam a number of years ago. We're so happy to share that if that's of interest. But I think in terms of intersectionality, that's something that really strikes us as, you know, a key gap.
Yeah.
And I think Nicola already we, I think based on request from some international organizations, so they ask us to do evaluations, and they change the design of their program, and they introduce some services, and they modify their programs based on the evidence we created for them.
Yeah, that's a good point.
Very good. Thank you both. Okay, so a couple of interrelated questions from Amal. Hi, Amal. So the first one is, when does the program consider a family no longer eligible to remain as a beneficiary from its services? And then another shorter question from Amal, which is whether the databases are shared across the programs.
So it's program dependent. So for example, the Cash for Education program is when you no longer have a school attending child, or the child becomes 18, then you are no longer eligible. And because of the vulnerability assessments, once there are other income earning adults in the family, so as boys in particular, you know, have more access to labor market opportunities, then they are often excluded from the program, whether that's a formal regulation or practically implemented by social workers given scarce resources. So that's the case with Jordan. Bassam, I think you mentioned it, right, with the Palestine case?
Yeah, yeah. In Palestine, so they do like they're supposed to do at least annual to run proximine test formula to assess the degree of vulnerability, and if the score is above 6, for example, 6 is the cutoff point, so they cut, and it depends on the indicators they use. And most of these are economic indicator, as Nicola mentioned. For example, in case there is the son, for example, is above 18 and is not enrolled at the university, so then they cut it. They expect that child works, for example. In case there is income, so they run annually. They run the formula, and the people who are not eligible according to the formula are excluded. But there are many people there for ages and ages, generations even.
I mean, on the point about sharing of databases, there have been efforts in Jordan across agencies to collaborate and have a common vulnerability assessment framework. UNICEF, however, for the Hajati program, has developed a child-focused vulnerability assessment, which had a different focus. So I think we've seen positive efforts, certainly in Jordan, to do that, but it does also then depend on the specific target group. And just while I was seeing it, I think, Jason, your question about are non-Syrian refugees in Jordan included? Yes, they are included in the UNHCR program, and then Palestinian refugees can have access to support from UNRWA, although the number of cash beneficiaries has been declining, particularly since the past US administration cut was, you know, responsible for a huge decline in UNRWA funds.
Okay, that's good. And yeah, thanks, Nicola, for keeping an eye on the questions in the chat as well. So I think there was still a question in the middle from Mohammed. Thank you, Mohammed, for your question. So that's a question on intersectionality and multilateralism. I'm not pronouncing that right. I think you've kind of already answered that, Nick and Bassam. So and then that took us to Jason's question. Thank you, Jason. Okay, so that's the end of the questions in the chat. Would anybody like to sort of come in further? We've got a few more minutes left. Just go into any more points in more depth or respond.
Rana, 2 more questions have popped up.
Yes.
I'll
read those out forever. Yeah, so thank you, Nefia. So, right, so you have an interest in working on the nexus and its impact on elimination of child poverty in the countries hosting a large number of refugee children like Turkey and Jordan. How far in your master's thesis, how far is Jordan linking the humanitarian cash transfers to development policies for child poverty? And then just to alert you, Nicola, that there was a follow-up clarification question from Jason about whether the project focus non-Syrians.
So I think it's a very good question about the links between humanitarian programming and developmental policies. I think that's been one of the key challenges in Jordan. With such a huge influx of funding at the height of the so-called Syrian refugee crisis. I think the best example there I can think of is, again, the links with the Makani initiative, which they moved deliberately away from relying on humanitarian NGO, international funding, to working with local CSOs and local NGOs. So that there would be a longer term legacy. And then the other positive thing, I think, is the linkages that have been slow to develop between the Ministry of Social Development and then the UN funded cash transfer programs, with an effort to ensure that then child poverty is seen as a critical pillar of the National Aid Fund, which is the main sort of a social assistance program that the Jordanian government funds. So it's happening, but it's really taken considerable time and effort, and it certainly isn't something that has happened in a streamlined fashion. I think some of the lessons that international actors are learning is that they need to embed those kind of linkages much earlier on. These kinds of discussions really didn't start to have any traction until the last sort of 3-4 years, I would say. And then just quickly on, did the project, do you mean, Jason, did GAGE focus on non-Syrians, or did? So we have a very small sample in Amman, so we're working on a number of governorates. So in Amman governorate, we do have some non-Syrians, but we are working with ex-Gaza and Palestinian refugees and Jerash governorate. And so there's a small sample, but it wasn't a core focus. But some of the Makani centers that UNICEF runs in Amman do have quite a large non-Syrian population. And then, sorry, I should say we have focused on the Dome, so a very excluded minority group, and that has been a particular focus. So non-Syrians.
Yeah, excellent, thank you. So it is 2 o'clock. I think there was one more final question, which I think, yes, is on the minds of a lot of Middle East observers from Amal. So want to make us go out with big thoughts expanding this. Might the Ukrainian refugee crisis impact funding availability from the international community to the MENA region?
Sadly, I think we're already seeing some of the impacts happen even in the last couple of weeks of programs not being continued, donors moving funding. So I think that funding volatility is a huge concern. Obviously, there's incredible need with the Ukrainian refugee crisis, but sadly, the funding is moving. So I think those points about how do we develop more sustainable initiatives are really, really essential.
Very pertinent. Yeah. Okay, well, colleagues, I think I want to thank everyone, thank our speakers, thank everyone who's participated. It's great to have this space and to share this information. Thank you all. We wish you a very good rest of the day, and good luck to everyone, and good luck, Nicola and Bassam, in the next phase of your work. And hope to see you all again soon, perhaps as speakers from the colleagues joining us for the first time. Thank you all, and bye for now.
Thank you very much.
Thank you very much.